All right, good morning. It's a great pleasure and privilege to be here, and welcome to all of my fellow delegates and to all of the sponsors and really collaborators. So let me get started with my remarks. So Joslin, as you heard, really is a unique institution, and I'm delighted to really be here to let you know that Joslin is all about collaborating, partnering. Really, how do we take our expertise that we've developed over 115 years and find creative and clever ways to share with all of you? We have 600 people in Boston, but we're certainly globally focused. So hopefully over the course of the next 2 days, we'll have an opportunity to really understand how we could share, collaborate, partner, how we can deliver our expertise. And to set the stage for that, here's a slide that perhaps many of you have seen, but I think it continues to really draw the point that diabetes is in fact a global challenge. And if you look at the numbers, they're just really staggering in some ways. 382 million people around the planet with diabetes. If you look at the 72 million that's really targeted here in India, we know that's a huge problem. But I think really two things that are worrisome as I look at this slide. One of them is, if you look there, it says about 46% of the people with diabetes don't know they have diabetes. So the problem is, if they don't have the awareness, it's not being picked up by the health system, then in fact their risk for developing downstream complications only gets more and more substantial. So the key is, what are we going to do about that? And then the other thing that if you look at down in the corner there, you can see that we're projecting by 2030 an increase from that 382 million people with diabetes to 592 million people. So you look at that type of growth in a relatively short time period. Again, it says this is a true global pandemic. And if you look at the percentages, especially those associated with India, a 70% increase projected over the next roughly 15, 16 years. Again, that's just not acceptable. So this tells us that we need to get going, we need to solve problems, and this opportunity to come together, I think, is a great way for us to understand how do we partner, how do we put our heads together to really start tackling this substantial disease. So I think many of you know, diabetes is a progressive disease, and maybe that's one of the challenges of it. People a lot of times don't know they have diabetes, it's undiagnosed, and unfortunately, until they finally realize they're having some problems with their vision, their kidney function maybe not at optimum, there's issues with their cardiovascular system, their circulatory system. So the nature of diabetes is it really does continue to escalate, and unfortunately, if it's not treated properly, if we don't really educate the patient, because the interesting thing about diabetes is it's really a patient, family, self-managed disease. Most of the care that's being provided is really being provided by the patient and their family as they think about their lifestyle, they think about their diet, they think about their exercise, they think about all the things they're doing. It all has a tremendous impact on their disease. And again, I think we can see that it progresses over time, and as it progresses, the cost of care, the longer we wait to pick up or recognize someone has diabetes, the longer we wait to basically help them get on a care plan, basically to help them change their lifestyle, think differently about their food, their exercise, their habits, what goes on in their daily life. The longer we wait to have an opportunity to affect that course of the disease, the more costly it is, the more complications arise. So again, there's a real paradigm shift here that has to take place. And again, I think there's an appreciation if we, have to focus on innovation, how do we leverage technology, and more importantly, how do we come together? How do we take all the talents that exist in this room and elsewhere, and how do we really put a much more clear focus on bringing solutions to bear for this disease? So as I mentioned, Joslin has been around for 115 years, and our focus is really on innovation. What we like to think of as what we do in Boston is really a test kitchen or an experimental lab for new ideas, new approaches, And then our objective is after we show they're relevant, we show they work, then we have an opportunity to really bring those findings in collaboration with others and disseminate them across the globe. So our objective is to try as many new things as we can. We recognize that some of them may fail, but we're not afraid of failure. We learn from failure. We understand that that's how we're going to continue to drive this disease. And as you can see, our ultimate objective at Joslin is pretty much eliminate diabetes. So we know that's a big challenge, but we know that's really what we need to do. And we spend all of our time really focusing on thinking about innovation, bringing solutions. And again, we want to be the catalyzer, the spark plug for those ideas, and then engage with all of you to find ways we can take the knowledge, take the insights. And again, we do that from a research standpoint, whether it's type 1, type 2 complications. We see patients in Boston, about 25,000 patients, but we affect probably another couple 100,000 through an affiliate model we have. And then through our educational efforts, we've probably affected millions of patients indirectly through educating healthcare teams. We also have a new initiative around prevention. So again, we're available. We're a not-for-profit. We exist to basically serve mankind, if you will, and we're very excited about being part of this great coalition. So again, I'm just going to highlight some of the things that are relevant for this Congress. We really do think about preventative health care. We have major efforts at Joslin thinking about food, nutrition, exercise, behavior change, lifestyle management, and again, how do we deliver that expertise, if you will, to others? So in a communities, in working with primary care doctors and working with families and others, how do we provide education? How do we pick up diabetes earlier? So what type of things we can do in screening? And again, we're looking at some new approaches there, some new technologies. And again, how do we come up with tools to help basically anyone or any institution or any government think about how do we really manage at a population level people that are at risk for diabetes or have diabetes. Again, new age healthcare. Again, we're very focused on the fact that given the magnitude of the numbers, we're not going to be able to, unfortunately, have enough doctors or endocrinologists available to treat this disease, if you will. So how do we really use the power of innovation, mobility, cell phones, technology, and connectivity? How do we basically use the power of all the things that we use in our daily lives? How do we direct that to making a difference with respect to diabetes? From a talent standpoint, we have lots of capabilities around virtual medicine. How do we deliver solutions to people in different parts of the world, again, through technology, through tablets, any means that are possible. And again, trying to provide diabetes decision support tools so it's easier for primary care doctors or community health workers to understand what type of health plan should I put this person on, what type of medications. How do I convince them to take their medications? How do I help them change their lifestyle? So we have a lot of initiatives there. And again, our whole mantra at Joslin is really collaborate, partner. So again, I think it ties into the public-private people partnership initiative of this effort. So we're delighted to be part of that. And then lastly, one of the other areas that we'll be focusing on over the next 2 days is the hospital of the future, and I think we're already seeing opportunities to really leverage the power of electronic health records. How do we really use telemedicine? And I know there's a lot of activities in India already, but how do we further use that to, in fact, prevent or screen or identify or provide health literacy capabilities to people with diabetes? And lastly, how do we give people the ability to get care, to get expertise at home? So the idea is you don't have to physically move or come to a clinic or a hospital perhaps. How can we bring that expertise that you need directly into your home? So those are some of the things that we're working on and would love to share some of our thoughts with others. So the last thing I would just say, here's a picture of Dr. Joslin. And I think, the one thing about Dr. Joslin I would say is he was a real pioneer when he started Joslin 115 years ago. As you can see, he was also a teacher. He understood that the real power of what we can do is how do we train others? How do we give others the expertise that we have? And that's really a big part of our hallmark at Joslin. And the other thing that I think is interesting, the medal that you see in front of you, Dr. Joslin gave that to people that had diabetes, mostly type 1 at the time, for 25 years. And now we give that medal to people with type 1 that have had it for 50 years. And in fact, we just created our first 80-year medal. So I think the important thing is, you know, we really stand for helping people anywhere in the world dealing with diabetes. And I think the other interesting thing about that medal, Dr. Joslin was also very astute in recognizing that it wasn't just insulin or medicine, but diet and exercise are a key part of how we're going to bring solutions to bear. So again, we're still leveraging that wisdom and expertise that he provided. Thank you very much.